Thank you very much. So my name is Donna Tafreshi, and I'm a project manager working with the BC Office of Patient-Centered Measurement. And in particular, the project that I've been working on is the migration of patient-centered measurement data to the Ministry of Health Health Ideas centralized warehouse, database warehouse. And so I'm going to tell you a little bit about the BC Patient-Centered Measurement Working Group today, the Health Ideas initiative to move patient-centered measurement data into the Health Ideas warehouse, and then how data is going to be available through POP Data BC. We'll have somebody from POP Data here to let you know how you can request access. And in particular, we're focusing on Emergency Department 2018 survey today, which is just being released and is going to be available for researchers to request access to. So I'll also tell you a little bit more about the survey. So my objectives here, going to be a little bit of reiteration of what I just said, but specifically I want to provide you a bit of background on the BC Patient-Centered Measurement data and the BC PCM Working Group. I'm going to also provide some background on the BC PCM to Health Ideas initiative that I just told you about. And I'm also excited to formally announce the release of BC 2018 Emergency Department data to researchers via Population Data BC. I will also provide some background information on the 2018 department survey, and I'll give you some preliminary aggregate level results. And I'll also introduce you to patient-reported experience measures and patient-reported outcome measures, which are the primary tools that were used in the emergency department survey. And then finally, as I mentioned, we'll have a presenter from POP Data BC, Melissa, who will tell you a little bit more about how you can request access to the data if you are a researcher who's interested in doing secondary analysis. I'll also pause at the end of my presentation and before Melissa's to answer any questions that you might have. And I also have Lena Cuthbertson here with me, who's the Provincial Executive Director of Patient-Centered Measurement. So she's also in the room if there are any questions that I'm unable to answer.
Hello, everyone.
So first, a little background on the BC Patient-Centered Measurement Working Group. The working group is a joint initiative of the BC Ministry of Health, all 7 BC health authorities, and their affiliate organizations. And since 2003, the working group has led BC's strategy for patient-centered measurement. So patients self-reports of their experiences, and more recently, since 2016, their health-related quality of life, or their healthcare outcomes, are solicited using PREMs, or patient-reported experience measures, and PROMs, patient-reported outcome measures. And I'll say a little bit more about those later on when I talk about the ED3. So the mandate of the BC PCM Working Group is to develop a coordinated, cost-efficient, and scientifically rigorous provincial approach to the measurement of patient and family self-reported satisfaction experiences and outcomes. And this is in order to enhance public accountability, support QI and evaluation, and to inform research. So there are a number of accomplishments that the Patient-Centered Measurement Working Group has accomplished from 2003 to now, 2019. So a few noteworthy ones to mention are, firstly, of course, the coordination of province-wide surveys. Second, feedback from more than 1 million users of healthcare services across the 13 sectors and subsectors, and of all age groups. The working group also collects both quantitative and qualitative data, and we also provide practical support to make effective use of data for QI and for accountability purposes. We also do public reporting, so we also put out provincial level, health authority level, facility, and sometimes unit level reports. And I'll give you a little bit of a glimpse into what some of the reports look like for the ED 2018 survey. So I'll give you some preliminary results today. And then also another accomplishment is the availability of data to clinicians and analysts across BC via an online platform in close to real time. So this is called the DART, or the Dynamic Analysis and Reporting Tool. And so as data is being collected, it's also put into this DART platform in what we say close to real time. So not exactly real time, but quite close. And this tool is primarily for QI purposes, so that individuals can go into the platform and see, what are people saying about my unit or the hospital that I work in as the survey results are being collected. And then finally, the other accomplishment is availability of data to health analysts since 2018, so raw data, and researchers now through PopData BC. So there are many ways to listen and learn, and the BC Patient-Centered Measurement Group acknowledges this. And so they use a number of different initiatives or different types of techniques to listen and learn from patients. So one example of this is that we recently conducted focus groups with patients across the province to ask them what they think the role of patients should be in patient-centered measurement. Now, the data that we're introducing today focuses on one particular technique that we use to listen and learn from patients, and that is the use of Provincial patient-centered measurement survey data. So the BC PCM working group employs a patient-centered measurement value chain in the implementation of their surveys. So this begins with survey design. So this includes selection of survey tools with strong psychometrics, development of tools or custom questions, and defining methodology. Then there's data collection, so distributing surveys to respondents and collecting and completing responses. Then moves on to data analysis, where we process the surveys, we collate the results, we might do some case mix adjustments or weight the results for disproportionate sampling if necessary, and we'll analyze the data. Then moves to reporting, so production of the results, and we'll do both quantitative and qualitative reporting. So we use both graphics and narratives. Then it moves to sharing the results, so dissemination of the results to key stakeholders as well as to the public. And then finally to action planning, so knowledge sharing, promoting mini-surveys or point of service QI initiatives, secondary analysis, which is where PopData BC comes in, and researchers' access comes in, and promoting cross-health authority collaboration. At the center of this all is what we like to think of being patients. So we try to engage patients in every step of this process. And as you can see, we consider it as a circle. So at the end of action planning, that leads to the next survey that we're going to start thinking about designing. So we have heard from over 1 million BC patients since 2003. Or their family members, and we've heard from them in a variety of sectors, including acute inpatient, outpatient cancer care, mental health and substance use, long-term care, residential care, emergency department, as we'll talk about today as well. So this table just gives a more complete picture of all the surveys that have gone into field since 2003. So you can see there's the 5 major sectors that we've conducted surveys in. And also, as you can see, we've conventionally employed point-in-time surveys, but we're moving to a model in some of our sectors that utilizes continuous surveying. And many of our surveys also use mixed-mode sampling methodologies, including surveying by phone or online. And we have also conducted in-person interviews, particularly in the long-term care sector. So of importance to note is we have several upcoming surveys that actually are going to be exploring some new sectors. So we have upcoming the surgical services or the hip and knee replacement survey. We also have a survey focusing on primary care and mental health and substance use, as well as a continuous survey that's going to be going into field for 2 years that focuses on continuity across transitions in care, and in particular, transitions into the emergency department and out of the emergency department to community, or out of acute care into community if the patient was transferred into an acute care bed. So I'll tell you a little bit more now about health ideas, because the data from all of these surveys has been and is continuing to be moved into the Health Ideas platform in the Ministry of Health. And that's how it's being available now to researchers through PopData BC. So Health Ideas is the Ministry of Health's integrated data warehouse environment, and it provides access to administrative and service event data to authorized users. It also provides access to POP data, which researchers can use to request data from. The overall goal of Health Ideas is to support secure access to a wide range of ministry data sets, either to users within the ministry or for external users, such as researchers. So this movement of patient-centered measurement data into the Health Ideas database to make it more available for secondary analysis is funded by the Strategy for Patient-Oriented Research. So SPORE is defined by the Canadian Institutes of Health Research, is being conducted by multidisciplinary teams in partnership with stakeholders, as research that engages patients as partners, focuses on patient-identified priorities, and improves patient outcomes, and research that aims to apply knowledge generated to improve healthcare systems and practices. So this next slide here just shows you all of the data sets that are currently available in Health Ideas. And we're doing a phased rollout of the availability of the data sets to researchers through POP Data BC. So we developed the metadata materials, the support materials for these survey data, and once that's ready, we release that data through POP Data to researchers. And so so far, we began releasing data with the Acute Inpatient 2016-17 survey in February of 2019, and now is our second survey release with the Emergency Department 2018 survey. The next one coming up is the Office of the Seniors Advocate Residential Survey 2016-17, and that's going to be released this fall. So just a few notes here about restrictions on data use. So it is possible to link this data to other Ministry of Health and non-Ministry of Health data. Of course, it's subject to appropriate approvals and research agreements. And in addition, it's important to note that the Ministry of Health and relevant health authorities must also be notified of forthcoming publications or reports based on patient-centered measurement data at least 45 days in advance of publication. And I think that's quite standard process for any Ministry of Health data sets available through POP Data BC. So researchers would just notify POP Data when a publication is forthcoming, and POP Data would notify the Ministry of Health data steward. So now I'll tell you a little bit about the Emergency Department survey, which is the survey that has data that's being released as of today through POP Data. So first, just a general overview of, I guess, the method of BC surveys and how the BC Patient-Centered Measurement Working Group has generally gone about this process of actually conducting the surveys, carrying them out. So this process typically begins with conducting the survey, which I talked about already, the different steps in our value chain. And during that process, we have close to real-time access to scores provided by our web-based reporting platform, the DART. Once that data comes in, it's cleaned up, and also we conduct analyses and we do adjustments. And then we do public reporting of the provincial and health authority results. And the data is intended for system-wide quality improvement, program evaluation, and accountability purposes. Once that's done, then we move the raw data with identifiers into Health Ideas. And in that sense, the data is then intended to inform and support research and to support cross-sector, cross-health authority secondary analysis by researchers and analysts in the health authorities and the Ministry of Health. So that's the step that we're at today with the Emergency Department 2018 survey. So the methodology for the ED 2018 survey, I'm going to describe to you in a few steps. So first, the health authorities and their affiliates sent patient records to our data collection vendor, RA Malatas, twice per month for 3 months. So the survey was conducted between January and March of 2018. So the survey vendor would then draw a random sample from the patient records, and then sampling would occur particularly from the valid sample. So I'll tell you a little bit about exclusion criteria in a couple of slides. For emergency departments that had very low annual volumes, Malatas would draw a census sample. So they would just sample every person who we received a patient record for. The next step was then to send notification or invitation letters to the sampled patients within 1 week of receiving their discharge records from the health authority. And so these letters would notify the patients that they've been selected to participate in the phone survey. Or they would actually also have the opportunity to use a unique access code to go online and complete the survey themselves. So then the Malatet surveys would conduct the phone-based interviews, and those interviews use questionnaire scripts, prompts, and responses to FAQs. And then finally, the fifth step I already mentioned, patients were also given the option of completing the survey online. So if they did choose to do that, they wouldn't then receive a phone call from the survey vendor. And then note that the surveys were also available in multiple languages. So we have all the languages listed here: English, French, Chinese, Punjabi, German, Vietnamese, Spanish, and Korean. So in total, 108 emergency departments were sampled in BC. So that represents all of the emergency departments. And they were, again, as I mentioned, sampled between January 1st, 2018 and March 31st, 2018. We also conduct some of our analyses by putting facilities into peer groups based on the volume of the facility. So we have large, medium, small, and extra small facilities. And so you can see here that large facilities are those that have annually more than 40,000 visits by patients. And so the total number of large facilities sampled was 19. Medium facilities, the total number sampled was 21. Small was 36. And we also sampled 32 extra small facilities. So these are facilities with less than 5,000 annual patient visit volume. So there's two different sort of sets of exclusion criteria I can talk about. So the first is exclusion criteria that's applied by the health authorities before they actually send patient records to the survey vendor. And so, for example, infants that are less than 10 days old, or mothers who had abortions, stillbirths, or miscarriages, and suspected or confirmed sexual abuse or other types of violence, those patients are excluded to protect them from further harm or grief that could be caused by receiving a survey in the mail. So this exclusion criteria is, again, applied before the records are actually sent to the survey vendor. There's another set of exclusion criteria that's applied by the survey vendor, which is sort of like cleaning the data file. So these additional exclusion factors include things like patients who ask us to be removed from the study, deduplication, or patients who don't have valid PHN. So in total, we had 14,076 patients respond to our 2018 emergency department survey. And this number includes only those who completed at least 50% of the survey. So that's what we count as a complete response. And so our response rate was 35.9%, and the margin of error at 0.8%. So this slide just shows the number of respondents by health authority for those researchers who might be interested in looking specifically at a given health authority or region. And I'll also give you a little bit of some respondent demographics. So 53.9% of our respondents were female, and 46.1% were male. And you can see here the breakdown by age. So we had individuals in our study younger than 6 years old, as well as over 65 years old as well. This next slide breaks down the respondent demographics by ethnicity. So we asked a question that adapted from the Stats Canada question about ethnicity. And so this shows you a breakdown of the diversity of respondents to the survey. A little bit more demographic information. So 16.4% of the respondents arrived to the emergency department via ambulance. And we do ask a specific set of questions about those patients' experiences with the ambulance as well. 25.1% of respondents stated that the main reason for their visit to the ED was due to an accident or injury. 43.8% said that it was due to a new health problem, and 29.1% said that it was due to an ongoing health concern. So I'll tell you a little bit more now about PREMs and PROMs, so patient-reported experience measures and patient-reported outcome measures, and in particular the ones that were included in the current survey. So together, PREMs and PROMs assess patients and sometimes their families' self-perceived health outcomes and experiences of relevance to their quality of life. So you can think of PREMs as asking patients, how is the care you are receiving, while PROMs ask, how are you doing? So PREMs measure global ratings of experience, overall perception of quality of care, domains of patient-centered care, such as respect and dignity, information sharing, access and coordination of care, emotional support. And then PROMs focus more on health-related quality of life. So things such as overall self-reported health status, symptoms, mental wellness, and ability to take part in day-to-day activities. So first, I'll tell you about the PREMs that were included in the ED survey. So we have the Emergency Department Patient Experiences with Care Survey, or EDPEC, and two versions of it were used. One version is for those patients discharged to community, and the other one is for patients admitted to hospital following their ED visit. That one just contains two additional questions that we asked of those patients. We also had some Made in BC questions and modules, and the topics of these modules included things like, as I mentioned, patient experiences with their ambulance transport to the ED, their experiences of having an IV in the ED or ambulance, patient-centered care, emotional support, respect for culture and tradition, patients' perspectives on safety, including hand hygiene, medication reconciliation and harm, patient experiences of continuity across transitions in care, and this aspect of the survey actually informed our upcoming survey that's going to focus specifically on continuity. And then finally, patient needs for home support following discharge. And at the end of our survey, we also ask open-ended qualitative feedback. So we also have narrative feedback, comments that patients can choose what they want to tell us in addition to what we've already heard. So a bit of a preliminary result. We asked some global rating questions of patients about their experiences of care in the emergency department. And you can see here that some preliminary results show that 49.4% of patients rated their care during their ED visit as a 9 or 10 on a 0 to 10 point scale. 53.2% rated their overall experience during their ED visit as a 9 or 10 on a 0 to 10 point scale as well. We also asked two more global rating questions here. So 63.4% said that they would definitely recommend their emergency department to their friends and family. And 62.9% rated a 9 or a 10 on a 0 to 10 point scale, asking whether they felt helped by their ED visit. So these are just examples of some of the results coming out of the survey data. But what we're hoping for researchers to do is to take some of these items that we have and actually do more in-depth secondary analyses. There's lots of information here that could be linked to other data sets as well. So I'll show you an example of some of the information that we received from some of the survey items within the different domains. So one of the domains or dimensions, as it says here on this slide, that we looked at was getting timely care. So one question in this dimension was, did you receive care within 30 minutes of getting to the ED? And so you can see that this question here is broken down by peer group. So we have the BC average, and then we have large facilities, medium, small, and extra small. And it appears that smaller facilities do better in providing care to patients in less than 30 minutes than the larger facilities. Another dimension focuses specifically on informational continuity and the broader dimension of continuity across transitions in care. So an example of a question asked here is whether patients received consistent information from their doctors, nurses, and other emergency department staff. So you can see here again, we've broken down the results by peer group. And another question asked here is whether patients received information in writing about what symptoms or health problems to look out for after leaving the ED. Okay, so as I mentioned, we also collect patient-reported outcome measures results. So the two PROMs that were included in the ED 2018 survey were the Veterans RAN 12-Item Health Survey, or the VR12, and the EQ 5D5L. So I'm going to say a little bit more about the VR12, but I will just add a note here that the EQ 5D5L, that data is not currently available for secondary analysis. We received permission to use this instrument to collect data for the purpose of a side-by-side research study that researchers at UBC and SFU are currently working on. So we will be publishing information on the findings of this study at a later date. Currently, the data collected for using this instrument is not going to be available through POP data, but the data collected using the VR12 is. So I'll tell you a little bit more about that. So the VR12 is a general rather than a condition-specific PROM, and it's used to measure health and quality of life from the patient's perspective. And it's also actually used to estimate disease burden. So it includes 12 questions that measure 8 domains of current physical and mental health status, and 2 additional items that ask the person to reflect back over their past year. So this image was taken from the developer's website, and I'll just start from the bottom here and explaining the different domains and then how those work up into the component scores. So as you can see here, there are 14 items. There's the 12 items that I mentioned that sort of funnel into those different domains, and then there's the 2 additional items that ask the patient to reflect over the past year. So the 8 domains are general health, physical functioning, role limitations that are physical, role limitations that are emotional, bodily pain, vitality, mental health, and social functioning. And then these domains also work up into these 2 larger components, physical health and mental health scores. Now, we're cautioning against computing physical health and mental health component scores at this point because we don't have norms based on British Columbia established yet. And that's part of what the study that the researchers from UBC and SFU are working on currently is hoping to do is to establish some norms. And so what we've done with our reporting is we've only reported domain scores at this point. So here's what we're seeing from the data in terms of domain scores. So BC Emergency Department patients reported the highest or best scores in relation to their mental health status, and the lowest scores in terms of the limitations in their ability to carry out their daily or typical roles due to physical abilities. So these results are going to be useful for future analyses, and we're hoping for researchers to run secondary analyses on this data. So for example, we might explore whether a patient experience varies based on level of bodily pain or social functioning. And as I mentioned, researchers are currently establishing BC norms for the VR12 instrument. So this will also allow us for the comparison of health status across BC regions, hopefully as we move forward. Okay, so that is it for me. My last slide is just to say that we at the Office of Patient-Centered Measurement want to support you. And I listed the contact information of my colleague, Ben Chow, who's a senior analyst. So if you think of any questions after this webinar that you forgot to ask, or if you're watching pre-recorded, please feel free to contact Ben with any questions, and he'd be happy to help you out. So I guess I'll pause here to see if there are any questions for me or for Lena, who's also in the room, before I pass it on to Melissa for questions. see the chat box, so if there are any questions in the chat, if you could read them out to me, that would be great.
All right. This is Melissa from Pop Data.
Hi, Melissa.
Are you ready to move on? Hi.
It doesn't sound like there's any questions, so why don't we move on to your slide?
Okay. Okay, so hi everyone. I'm Melissa Medeiros, and I'm a data access coordinator at Population Data BC. I'm just going to give a short overview of Pop Data and how you can access the 2018 Emergency Department Survey through us. So we are an organization that facilitates research on health, well-being, and development. We help researchers prepare requests for data access and help them coordinate the assessment process by the owners of the data, who we call data stewards. If the request is approved by the data stewards, we help provide the data to the research team and provide secure storage for the study data. So as you can see on this slide, we have a broad array of data sets, including the Emergency Department Sector Survey under the patient-centered measurement. Could you move on to the next slide? Thank you. So to apply for data, researchers will need to complete Pop Data's online data access form that researchers can access via our website. You will need a Pop Data account to complete this form. A link to where you can register for an account, if you do not already have one, is included on my final slide. We have a team of people called our Data Access Unit, or DAU, at Pop Data who work with researchers to prepare their requests and answer their questions, and to ensure that when a data access request goes to the data stewards for their review, that it's complete, consistent, and has all the information the data stewards need in order to evaluate the request. The Data Access Unit coordinates and facilitates the various stages of the data access process shown here, from the initial inquiries and the data access request form all the way through to project closure. Could you move on to the next slide, please? So if you're hoping to use the PCM data as we discussed today, please contact us at Pop Data, and we'll be happy to go over the process with you and provide guidance for your data access request. And our how to contact Sarah is on this slide, but if you also want to contact the Data Access Unit directly, it is dataaccess@popdata.bc.ca. Is there any questions? If anyone has any questions later, you can always feel free to contact Sarah or the Data Access Unit, of course, about how to access the patient-centered measurement data.
Okay, sounds like there aren't any questions.
Okay.
Thank you.
Thanks for organizing.
Great. Well, I guess that's a wrap.
Okay.
All right. Thanks, everyone. Yes,